Lesch-Nyhan syndrome is an inborn error of metabolism. It's a mutation in the HPRT enzyme, which is part of the purine salvage pathway. This mutation causes an increased production of uric acid, which then goes to the kidneys, and you'll get kidney stones, you can get gout, tophi deposits. Another hallmark finding of this disease is neurological involvement, so you'll get mutilating behavior, self-mutilation, which is in about 85% of patients. And there's also motor findings like dystonia and chorea. That's thought due to because the increased uric acid levels then in turn decreases dopamine. It's an X-linked recessive disorder, so it typically affects males, and presentation is typically between 3 months and 1 year of age. So common findings on presentation would be the motor, so dystonia, chorea. It's also sometimes present with hematuria or like an orange sand-like deposits in their diaper, which is from the uric acid. The self-mutilation typically develops later, around 3 or 5 years of age. There's some possible developmental delay, and the prognosis for this disease is poor, with typically death occurring by 20 years of age due to renal failure. So differential diagnosis is cerebral palsy because of those movement presentations early on in life. So part of the workup, it's diagnosed with either a genetic test for the mutation in the gene, or you can test for the enzyme, the presence of the enzyme. Other important tests to order are a BMP to get the base kidney function, and also CBC because macrocytic anemia can be found in these patients. Treatment, you can treat with allopurinol and behavioral therapy for the self-mutilation. Overall treatment is pretty much supportive. There's no cure. And complications or concerns, like I mentioned, there's the macrocytic anemia, kidney stones. There's also a chance of